Hello, good evening. This is Dr. Chetna Jain, Director Ops and Gynae at the Cloud9 Hospital Sector 14 and Director Owner at Dr. Chetna's Clinic in Palam Vihar, Gurgaon. So today we are going to talk on a topic which is very, very relevant to you, and the topic is post-pregnancy care. So majority of the times we've been talking about how to do, what are the problems during pregnancy and so on. But today majorly we're going to talk on how to look after yourself after the delivery. Number one, point number one, take plenty of rest. So, what is plenty of rest? Minimum you have to rest for 2 to 4 hours in the day and 8 to 10 hours in the night. Now, how do you think it is possible when you have a very small child demanding feed and cleaning the potty or urine every 2 3 hours? So, what you can do is you can take the help of people around you. So, what you and your husband should sleep in separate rooms, or the caretaker who's with you, so that both of you can have ample sleep. Otherwise, when the child gets up, if both of you get up, then nobody's going to get adequate rest. So the idea is, suppose you in the morning you're looking after the baby, then you go to sleep around 7 in the night evening, and you can get up by 1 in the morning. By the time your other partner can look after the baby, and then other partner goes off to sleep, say around 1, and then he can have his rest till 8 in the morning. So that way both of you will get rest. Now, what happens between 7 and 1 when the baby would need one feed? So, an expressed milk, which is kept at room temperature, can be fed easily with a spoon or with a ladle to the baby, and everything can become easy. So, what is very important is take adequate rest, because if you don't sleep well, you have not slept well in the last couple of weeks or months before the delivery, and now you've not been sleeping. Most of you are over 30 years of age, and the body is not able to cope up. We understand that there's very limited physical work during the first 40 days in the house. Nobody's asking you to do anything. But even looking after the baby and yourself is a big task when you are not able to sleep. So if you can sleep like this, then it'll be very good. You can also change the life cycle, or the sleep cycle of your child, in a way that you do not allow the child to sleep after 5 p.m. Most of my pediatrician friends will disagree with this, that you should not disturb the child cycle. But it is also important for the mothers to take rest, because if their mental and physical health is not good, how do they look after the baby? So what I suggest is, like, do not allow the baby to sleep between 5 and 9. Thereafter, if the baby will sleep for longer hours, and you will be able to take rest. So this is extremely important. Point number two, seek help. Now, seeking help means what? You take help from husband, from mother-in-law, or sisters who are around. So certainly all of them would want to sleep in the night. So I suggested that you sleep till 12 or 1 in the night, and you get up, and after that you take charge. And again, once in the morning around 6, you go back to sleep, and others get up and they look after. So that's it. That is the best. The other thing that the mistake that most of the people do is they call their mother and mother-in-law both for delivery. And by the time 10, 15 days post-delivery, both of them are tired, because these women are typically between 50 and 60 years of age. So my recommendation would be, you call them one by one. Maybe they can visit you once, have a look at the baby. Then one goes off. So for our first month, you have one person, and for the next month, you have another person. So that ways you can have adequate rest. Or maybe what you can do is, your mother-in-law can stay initially, and later on you can go to your mother's house and take rest. So resting is extremely important. I see a lot of couple fighting, and those who are best friends are not on good terms anymore, because as soon as the husband comes home, the wife wants to give the baby to husband. I look after the child. I have looked after the whole day, and now I have no energy. I want to take rest. The same thing the husband feels, that I have been working very hard through the day and I had a bad day, and now I want to rest. I cannot look after the baby, and the fight begins. So it is very important that you take help in a way that both of you are relaxed and you enjoy the rearing of the child. And rather than fighting, you can spend good family time and have some nice time. Third thing is, eat healthy. Now, what is important? What is healthy? Typically, after delivery, a lot of junk food is given to the mothers. I'm coming to that a little later in this article. Today, so what you should be eating? Eating healthy means consume adequate amounts of protein, dairies, vegetables, and fruits. So you just can't focus on one thing. So for a normal vegetarian diet, probably say 3 4 chapatis a day, big bowls of dal a day, two big bowls of green vegetables, and two bowls of salad, and about a liter of dairies in whatever form you like, paneer, dahi, or milk. So You can add some added proteins to the milk if you like it. If you don't like it, you can just have it. So what is important is have your meals on time regularly. Then the next, if you are non-vegetarian, you're allowed to eat everything. You can eat the eggs, you can eat meat. Obviously it has to be well cooked so that you don't catch infection. But a lot of families, even though they regularly eat non-vegetarian food, when it comes to the recently delivered mother, they do not want to give that. This is not a good idea. Then exercises. So a lot of you are restrained into your room and not allowed. But this is not right. You can start exercising as soon as you feel good after delivery. That means after normal delivery, possibly 4 or 5 days, and after cesarean, a week later, you can start exercising. As I see a lot of women coming to me 3 months after delivery asking whether they can exercise. And I find it very ridiculous because somebody told them that if you exercise a little early, the uterus is going to prolapse or something bad will happen. Look, if you do exercises regularly, your body will get toned up and you have lesser chances of things going the wrong way. So it is important to start exercising as soon as possible after delivery, certainly no later than a week. Initially, you can do just simple walks and gradually you can build up as and when your body allows. Now, what are the alarming signs for the baby? So certainly this is a pediatric thing, but I thought I can have a few points. So when you should be worrying and when you should not be. Typically, a lot of babies would not pass stool for a day or two. They are constipated, and there would be other babies who are passing like 12, 14 stools a day. You should not be too worrying as far as the baby is sleeping well. But if you think your baby is crying all the time and it is unexplained, if the baby is irritable most of the time, if the baby is not been sleeping, the baby is very sad all the time, there are mood changes, restlessness, then you should take the baby to the pediatrician or the neonatologist immediately. But if this is not the case, then there's no urgency. You don't get panicky about small things. However, if you are in doubt, you can talk to the pediatrician to know whether this behavior of the baby is normal or no. Now, coming to postpartum depression. Postpartum depression is a very, very common phenomenon. Nowadays, the mental health issues have cropped up like never before. Now, we come across a lot of women who are really depressed. Earlier, probably the women were so suppressed that they never had a time to take out to speak about their fitness, the mental fitness. But nowadays, women are vocal about it, and that's how we come across more women telling about not being well post delivery. And if this is the case, you seek a psychological counseling or mental health associations are there who can help you out. Please speak to your mothers, your sisters, your doctor, and come out of it. Do not restrict yourself. There's nothing abnormal here because of the low levels of hormone. You might be feeling low or weak, and in this scenario, it is all right to come out, to take help, and to feel better. There is no shame in that. So please speak to your doctor if you don't feel good mentally. Now, so, and the families should also be able to recognize if the woman is mentally unwell. So these are, so how do you know that you are having a postpartum depression? So there's a feeling of guilt, there's a feeling of worthlessness, there's loss of interest in the daily activity, there's withdrawal symptoms from the family, there's no interest in the baby, there are thoughts which comes to hurt the baby, and these can develop anytime after birth up to 1 year. So anytime if the people around you or you yourself notice such changes in yourself, kindly contact the relevant authorities, that includes doctors, psychological counselors, or mental health associations, so they can help you out in coping with these situations so that you're able to come out of it. We will be talking about the myths a little later. So now coping with the body changes. Now what happens is before pregnancy, probably you are weighing between 50 and 60 kilos, and you could wear all kinds of dress. You can expose your belly or arms or legs without any fear of any comment. In India, we are very particular about the body shape, and any fat person is if they're wearing skirts or shorts, there are a lot of negative comments, and possibly we are still not strong enough to take it. So my suggestion would be, you must understand that there will be some bodily changes and it will be a while before you fit into your previous dressing. So please do not bother if you're not fitting into your old dress. It will be a little while, maybe 6 months before you can actually enter that. And after delivery, majority of the times, the problem that you face is the rest of the body is still looking better, but the belly is hugely large. It's protruding out of proportion. It's out of the body. And then you feel really messy with that. You don't know what to do. So you try to tie a belt, which is not a good idea. So the best advice here is sorry, is to see a physiotherapist, and they will be able to help you in doing exercises which can put the belly in. So nothing else can help other than taking the help of a physiotherapist and doing the relevant physical activity. A lot of you get pigmented during pregnancy, the neck, the forehead, the underarms, the bikini area, the breast and abdomen. It turns darker. So it fades away with time. Give it time, 6 months, you will feel better. But if not, then what you can do is you can go to the salon and get some body polishing and scrubbing done so that the dead skin goes off faster and you retain your original skin color earlier. Now, melasma or butterfly rash on the face. So this is something which we need to look after during pregnancy. As soon as you get pregnant, especially the fair-colored women, they should apply large amounts of sunscreen, something like SPF 50, and they should replace it every 4 hours. Otherwise, they get pigmentation on the face, and this can lead to problems of abnormal marks on the face, which is probably a beauty dampener. So I would recommend that. Pay attention, apply your sunscreens well, and somehow even after that, or you didn't pay attention, you're too tired to look after yourself in pregnancy, and they've come up, then probably you see a skin specialist and see what best can be done to reduce the marks, but do not feel bad about it. Then stretch marks on the tummy. That's a big deal because a lot of women have they had extremely distended belly and post delivery, a lot of stretch marks on the tummy. If the stretch marks are formed because of inapplication or poor application of the emollients or sudden weight gain during pregnancy, so both needs to be avoided. Now that you've gotten them, try and use some stretch marks reducing creams. There are certain creams which boast of bringing back collagen to the skin. You can speak to the dermatologist and take such a treatment and see what best you can do. Meanwhile, nourish your skin with coconut oil and keep pulling it all inside the tummy all the time and see what best results you can get. Then don't compare yourself with others. See, what happens is the thinner women, they get back into the shape very fast. They gain less weight and they shed fast. The women who are fatter or above the they have larger BMIs. These women, they tend to gain more weight and they are unlikely to shed it faster. So there is no rule of thumb for anyone. You decide your own pace and lose your weight accordingly. The breast tissues. Now, what are the various breast tissues? One is the breast lumps. Now, what is recommended is after you feed the baby, you should examine the breast. The number one point is feed the baby from one breast only. Do not jump on both the breasts at one session. So, if you feel that after the breast is complete, the baby is completely fed from one breast, and in spite of that, the baby's abdomen is not full and the baby is still hungry, then only you can put the baby on the next breast. Otherwise, one time, one breast is the right policy. And after feeding that from that breast, you examine your breast. And if you think any lump, then you do cold compress and remove the excess milk so that you do not form any lumps which are a potential for mastitis, that is infection or pus formation. So please pay attention and ensure that you do not get any of such marks, the lumps. Then cracked nipples. Now, cracked nipples are a very common phenomena because of the baby sucking. Sometimes the nipple gets dry. Sometimes the baby chews the nipple and it gets cracked. So what is important is first you apply your own milk every time before feeding, and after feeding the baby, take out few drops and spread it over your nipples. So it ensures that the nipple cracks, which comes over time, they get healed faster because the milk has a lot of healing property. If you can't do that, or if it is not enough to heal the cracked nipples, and there are various creams available in the market, you can apply those and they should soothe and help. The other method for that you can use is nipple shield. So nipple shield is typically made of a silicone. It is sterilized by boiling, or yeah, that's the best way. And then you can hold it onto your nipples, and the baby can feed better through that. The same applies for women with inverted nipples. So there are suction tubes, suction mechanisms available. Even the nurses in the hospital can give you a syringe to suck out your nipples. But so typically what you can do is you place it on the nipple, on the areola, and try to suck out the nipple. As soon as this nipple comes out, you try and latch the baby, and this should work. But suppose this is not working, then the second best option would be to use the nipple sheet, the silicone sheets through which the baby can suckle, and you will not have problems with inverted nipples. Then the baby not latching is another problem. So you must ensure that your position is correct, that the baby's nose is not getting compressed, that you are not keeping your breasts are not over engorged, that your breasts you are not tight. The position is correct. And in spite of that, if you still can't latch the baby, then you should see a lactation consultant, which are available at most of the hospitals, and they should be able to guide you on how you can handle a baby not latching onto the breast. Engorgement. So engorgement is again something that there's a generalized hardness and the swelling of the breast, and it is extremely important to express the milk every 3 hours or 4 hours from one side. Otherwise, this will get engorged, and engorgement can lead to mastitis, that's infection, and finally pus formation. So please do not allow the breast to be engorged. And if you think it is engorged before the time of the feed has come, take out, express some milk, and this expressed milk can also be given to the baby. Then weight loss. So whenever you come on your first visit after delivery, you say that, doctor, I have lost 4 kilos or 5 kilos. This is probably not correct, because post delivery you should be losing at least 7 kilos, because that is the weight of the baby. This is on an average, considering that your baby born was about 3 kilos. So about 7 kgs is lost within a week, because of the water retention, the placenta, the uterus, the amniotic fluid, and the baby all coming out in the uterus involuting. So if this is not the case and you haven't lost 7 kgs, so whatever you're weighing less is probably that. If you've lost only 4 kgs, that means you have actually gained 3 kilos in the 1 week after delivery, and you have to be extremely careful not to gain weight further. So it is very, very important to pay attention and avoid any kind of weight gain post delivery, because the weight that you gain post delivery is very hard to lose compared to the weight which comes in pregnancy. Then constipation. So constipation is a very common phenomenon, because in most of the houses, women are not given adequate water, or they are just given ajwain water, and probably that ajwain water they can't drink more. So during breastfeeding, you need to take 3 liters of water every day. This is to suffice for the breast milk and your own health, because you've not been walking too much. So for the intestines to move, you need adequate water, and this water will also help prevent the urinary tract infection, because of the prolonged wearing of sanitary napkins, or which can be up to 4 to 6 weeks or maybe 8 weeks sometime. So it is extremely important that you drink large amounts of water and maintain the constipation and the urinary issues. Night sweats are very common. So when you feed your baby, you start sweating, so which can happen in the daytime and or in the nighttime. On top of it, the family wants you to cover. It's not the right thing to do. So in case you think that you're having a lot of sweats, please take bath more than once and get rid of the sweat. Because the more you're comfortable, the better health you will feel, and less lethargic and less tired you will feel. So it is very important to keep yourself away from the sweat. Then the pelvic floor changes. Now, after pregnancy, so pelvic floor becomes a little lax, more so after normal delivery. So it is extremely important for you to tone it up to prevent the anal incontinence and the urinary incontinence, that is the leakage of the urine while coughing, walking, or otherwise. So you must start doing Kegels exercises soon after delivery. Talk to your doctor and find out the right time to do it, and do it regularly throughout life, so that you get a better tone of the vagina for sexual satisfaction, and also the urinary incontinence and the anal incontinence will reduce remarkably if you do your Kegels very properly. Now, after pains, what are after pains? A lot of you complain that while breastfeeding, you feel severe pain in your lower tummy and a bout of blood comes out. Yes, this is true. This is because of the oxytocin which is released when the baby is lactating. And this oxytocin is causing the milk ejection reflex. But along with that, this oxytocin is also working onto the uterus and causing uterine contractions, just like labor pains, and the blood will flow. Whatever is collected into the uterine cavity will be pushed into the vagina, and suddenly you find a gush of blood or clots coming from the uterus. This is very normal, and typically the involution happens in 10 days' time, and beyond that, you would feel very minimal or no after pains. Now, bleeding and vaginal discharge. So, a lot of women who have had cesarean, because of during cesarean, the uterus is clean by a mop inside. So, very little bleeding comes because no membranes or the blood is remaining behind to be thrown out later. But in case of normal delivery, these stay inside and they come out gradually, and it might be 4 to 6 weeks or even 8 weeks before these come out. So do not get worried if you have less bleeding initially, because this bleeding will come eventually as the lining will break and form and break and again. So, but in normal delivery, initially the bleeding will be more, and gradually it will reduce, and finally it will finish by 6 8 weeks. Perennial pain. For all those who've had normal delivery, there would be perennial pain. The perineum feels very raw. So what you can do is either you use a ring cushion so that your surrounding buttocks will rest onto the cushion and the episiotomy area is free and there's no weight on that. Or else you can press a pillow against your stitch line and you feel good about it. You can use cold aloe vera packs. So what you can do is you can peel off and get some aloe vera from the plant in your house, apply it on the sanitary napkin, a thin layer, and put it in the freezer for a couple of minutes, say 30 minutes. And wrap it in the foil and then put it in the refrigerator. And these are ready to be applied. And if you apply it, this will give a lot of comfort onto your stitches. So you can use that. Now, while passing urine, you might feel uncomfortable while passing stool. So what you can do is you could pour warm water on your stitch line and you'll be very comfortable in passing stool or motion. You can also use hot sits baths. You sit in a tub, so you can put the tub on the floor or on a surface where you can sit and enter the tub and sit for at least 15 minutes, 3 hours, and you will find a lot of relief, not only pain, the healing also get better and it becomes quicker because it improves the blood circulation to the perineal or area or the stitch line. You can also use anesthetic sprays. So anesthetic sprays are the local numbing agents which can be sprayed over the stitch line and you can feel comfortable by doing that. Stool softeners are another thing that can be used to keep the stool soft so that there is no stretch onto the wound and you feel better. Now, so we talked about vaginal delivery. Now, what are the alarming signs when you should contact the treating team who has delivered you? So you should contact your doctor if you have severe pelvic pain, if you have severe pain on the stitch line, which is increasing over time, if you have first discharge coming from the stitch line or any other discharge which you can't make out, if you are bleeding like more than one pad is getting soaked every hour. So in this scenario, you should speak to your treating doctor and see what can be done. Now, piles could be another problem. So you see grape-like growth hanging around the anal opening, and you wonder what they are. So they are essentially blood vessels which has thrombosed and collapsed from the anal canal, and they're similar more inside. They increase with constipation. So whenever you have this, you can use hydrocortisone containing anal creams. You put it inside the nozzle in good quantities, and you can get relief of this pain. Also, you can have hot sits bath, but you can sprinkle some warm water, and you will find a lot of relief in your anal pain. You can use stool softeners to keep your stool soft so that you do not have much pain. Now we are going so the hair loss and skin changes. So during pregnancy, you have a lot of estrogen and progesterone, and a lot of women they have excess and their hair growth becomes nice, so they get good growth. And as soon as you deliver, because of the fall of these hormones, lack of rest, and inadequate iron intake, the hair fall start. So what is important is you continue taking your proteins very regularly. You should take iron regularly so that your iron stores are replenished. And if not, then you can also use some biotin to improve the hair growth. So do not allow your hair to fall, because whatever falls hardly comes back. Similarly, you will find certain skin changes. So drink adequate water, do adequate massage, take good rest, and you will feel rejuvenated and fresh post delivery. Now, what are the myths around childbirths? So I have gathered a few myths. So we are going to talk in general first, and then the myths around cesarean section. Here, I would like to thank a patient, Pushwani, who has helped me with the myths around the cesarean section. So I'm going to read them out for you. Number one myth: eat ghee to ease normal delivery. This is exactly the opposite. If you eat more ghee, you're likely to develop more weight, which can sit around the buttocks, and it can make your delivery more difficult. So please do not believe that eating ghee will ease normal delivery in any way. Then the second myth is delivery in seventh month is okay, but you should not deliver in eighth month. So it is completely incorrect. Certainly, delivery in eighth month is not good, but delivery in seventh month is worse. So each passing day improves the baby's viability and health condition, and the baby should be kept in the womb as much as possible. Typically, all the babies should be delivered, if possible, around 38, 39 weeks, unless there is some compulsion to deliver them before. So 37 weeks is term. So that is the best thing, but it doesn't mean that 35 is bad and 31 is good. This is not the case. So seventh month is never better than the eighth month. Uh, then they say that if the fetal heart recording, whenever we hear the fetal heart, they say if the fetal heart recording is below 140, is this going to be a boy? So heart rate has no connection, because if men and women both run, both of them will have faster heartbeats, and if they slow down, each one will have slower heartbeat. So the baby is also insan. So this will also behave in a similar way. So do not believe the rate of the heartbeat can determine the gender of the baby. Then other myth is if you turn dark, it's a boy. This is not correct. Your beauty has no relation. I will take up the questions. Just give me a little while. So your beauty has no connect. Your color, that if you turn darker, it's a boy. So this has no connection. Or if you turn more beautiful, it's going to be a girl. So again, it is a myth. Then another point is eat whatever you want in pregnancy. No, this is not correct. You can't be eating whatever you like. You must eat what is healthy and what is right and what is required. So you just can't be eating whatever you like. Then there are certain myths post delivery. So let's talk. One is don't brush your teeth. If you brush your teeth, they will fall off. This is absolutely incorrect. It's the other way around. If you don't brush your teeth, you are likely to they are likely to fall off. So please brush your teeth twice a day, one in the morning and second when you're going off to sleep. Then don't wash hair, it can cause cold to the baby. Certainly not. You must wash your hair, and if you think it's a cold weather, you can dry it with a dryer. But otherwise, your washing hair will never give any cold to the child. So it is extremely important to maintain your hygiene and wash your hair as per the weather. Eating spicy food causes loose motions to the baby. No, eating spicy food can cause loose motions to yourself, but certainly not to the baby. But if you're digesting a spicy food well and you're not having any kind of acidity, there's no problem, because no spice will ever get secreted into the breast milk. Then cover your head and wear socks all the time. This is not the case. Yes, if it is winters and if it is cold outside, certainly it's a good idea to cover your head and wear socks, because if you catch cold, you will be sick and you will not be able to look after the baby. But in summers, it is a weird idea to sweat, to feel bad. Your water is pouring from the forehead and from the hair, and still you are advised to cover your head and cover your neck and cover your whole body, and top of it wear socks is not a good thing to do. Do not drink too much water, otherwise your belly will come out. This is another funny suggestion. See, belly is abdomen and the water enters the stomach. So these are two different things. So drinking more water will not cause stomach to swell up and bloat the abdomen out. No, this is not the case. So please drink about 3 liters of water every day, which is adequate for your needs and for the milk needs of the baby. Eating rajma, chola, bindi, gobi, or similar will cause gas formation to the child. It can never happen. So, whenever you drink milk from cow or buffalo, do you ever think what cow or buffalo has eaten so that if they have eaten something wrong, you will have gas. No, this is not the case. So similarly, whatever you eat is not secreted into the breast milk except certain medicines or certain herbs. So hardly anything gets secreted into the milk, and milk's composition will always remain the same. So please eat everything which is healthy, and there's no restriction to just eating moong dal or lokki or similar. Then what is most interesting is you can eat laddus, but you cannot eat chapatis. Now laddus also have atta, ghee, chini and water, and chapatis also have atta and pani. So laddus have something extra compared to chapatis. So there's no difference. If you can eat laddus, certainly you can eat chapatis. Eating laddus is a bad idea if you are gaining weight. If you do not gain weight, you can still eat laddus. But my recommendation would be to have your the herbs and the medicines that which are deshi dawai we call them. You can have it, but without adding ghee, atta, or chini to the medicines. That means in a non-lead form, you can have dry roasted powder, swallow them with water, or add it to your chapati or sabzi and eat it. Then drink only ajwain water. And what happens is if you're given only ajwain water to drink, certainly you cannot drink adequate because you'll be sick of that taste and then you cannot finish your 3 liters. It's good to have ajwain in a limited quantity, but it is not that it is so overwhelming that you just can't have normal water. Certainly, you can have normal water. A good idea is to always have water a little warm or at room temperature, but that is good for everyone. It's not in particular for women who have delivered. So please, yes, it is best to avoid chilled water, but you can have water at room temperature. Then the other myth is to put the belly in, you must tie it with a belt. Now, I will give you here an example of money plant. The money plant can never have a strong stem because it is dependent. It is standing against a stick. Similarly, if you put your belly under a belt, your belly will never become strong because now the muscles are resting and they are not acting. Rather than putting a belt, you should pull your tummy in. So, what I recommend is if your belt is working as a reminder to exercise, then probably it would work. But if your belt is working as a binder, it will never work. So, please, please, please do not put belt and pull your tummy in. Start exercising early. Take the help of physiotherapist to put your belly in. These belts will never help. Then the other myth is stay inside, do not walk around, and to take complete bed rest. Complete bed rest will again lead to excessive weight gain, constipation, and other problems. What is recommended is do adequate physical activity. Whatever best you can do, whatever you can stand, should be done. So these are the common myths that I came across. And if you have more, please add on. I can read here for the rest of the viewers. Now, I will tell you about certain myths which a patient sent. And so, one is the myths about cesarean section we're going to talk. So, one is a complicated cesarean section is a complicated and risky procedure as many layers of skin are cut and there is huge blood loss. The blood loss at normal delivery and cesarean is almost identical because nowadays the episiotomies are very deep and they bleed a lot during stitching. They are deep and wide. So what I'm suggesting is do not believe that cesarean sections have more blood loss compared to a normal delivery. They are almost same. Then they say the baby also gets affected and you are heavily drugged during the procedure. So no woman is drugged during cesarean. The anesthesia given is spinal, which is given through a very small needle, almost like a hair in the back. And a small dose of anesthetic agent is just to numb the body so that this drug can never pass on to the baby. It's a local action. It is not a systemic or a general action, and the baby can never be drugged. So there's a lot of pain as the incision is very large and patient can't move around for a few days. So what is correct is post in the first 2 days, yes, cesarean section is much more painful than normal delivery, but beyond 7 days, the pain is almost identical, and majority of the women with cesarean section are more comfortable compared to normal delivery. But that doesn't justify that every woman should have cesarean. No. So if somebody is having a very smooth normal delivery, that's the best thing to do. But a traumatic vaginal delivery, where the baby also gets traumatized, is not the right thing to do. You will never feel normal again after cesarean. This is just not the case. All the women go back to normalcy, and majority will not notice or not feel that they ever had cesarean. Then they say skin around the incision area becomes numb. Yes, that is true. The skin around the incision area will remain numb for a while before the sensations return, and there's a possibility of sensations remaining low in that area, that is certain. Then say you cannot breastfeed the baby as you will be having a lot of pain. This is not correct also, because the pain is very limited. You will be able to feed the baby. There is no problem. We never have any problem with women breastfeeding the baby after cesarean. Then there has been increase in the number of cesarean deliveries because doctors' mindset as they manipulate the patients to have delivery. This is certainly not the case because majority of the doctors are on salary and they get paid from the hospital. It doesn't mean that, to do cesarean, I can extract more money, because this will give a bad repute to the doctor, if any doctor, because all the patients are educated and they can make out whether the cesarean was deliberate or the woman actually needed it. So majority of the patients that we counsel, they understand the situation. If the cesarean is required, we try our best to achieve normal delivery. And most of you nowadays cooperate also. But some women, they give up on their own. Other times the husbands give up, and sometimes the babies give up and they show distress. But the rest of the women, they achieve normal delivery. So each doctor would vie for normal delivery so that their data, their statistics look good and they have better patient clientele. Because if you have normal delivery and if you're satisfied, you will certainly talk to your friend. Now, it is very important for recovery that you do not do much work and rest for at least 1 month. So it all depends. If you're fit and fine, you can do basic physical activity and gradually build up over time. But if you're resting most of the time, which is the case in case you're not able to sleep, then certainly you will feel weak and tired, and you will not be able to gain energy and physical strength, and you will probably become fat. So a good idea is to take adequate rest and then do adequate exercise. Then we have already covered that you should cover your body entirely because you'll be more prone to diseases and changes in the weather. Not the case, but certainly if your immunity is low, this can happen. So remain strong, eat healthy, eat well, sleep well, and you're the same as any other woman. Then you cannot have products like milk or ghee after cesarean, and you need to consume only digestible food, and this would affect the baby. So this is not the case, because in cesarean also the intestine is not cut. So second or third day post delivery, you can eat whatever a normal delivery patient can eat, and you will have the same digestive power what other women have. So there's no difference in when you can start eating ghee or something. But I request to all of you who have delivered, please do not consume a lot of ghee, because ghee in excess quantity, the way it is given, like 10 kilos or 15 kilos over 40 days, is a very bad idea. So please, please do not consume that much amount of ghee. You will gain a lot of weight after cesarean section, and the stomach will never return to normal. Look, the belly protrudes after the normal delivery and after the cesarean. So both the methods will lead to protrusion of belly because of the pregnancy itself. So cesarean section has no contribution. But what typically happens is a lot of women go off to rest for 3 months or 6 months, believing that they have stitches and they cannot exercise. And if you don't do, then certainly the protruded belly doesn't go inside and look like it is popped out badly, because the rest of the body goes inside. Then the other myth is spinal anesthesia will cause back pain in future. So you have had cannula in your hand. Did it cause any pain? Yes, it caused pain at the time of insertion and removal or when it was inside. But can you feel it now? No. So the same is the case. If any needle goes inside the body and comes out, it can never have long-term impact. So never believe that cesarean section will cause backache. If so, then why women with normal delivery also have backache? So it is the inherence of pregnancy. It is the pregnancy itself which causes a lot of load on the back, and it results into the backache. And finally, once you've had cesarean, you cannot have normal delivery. This is completely untrue. After cesarean, VBAC, that is vaginal birth, is possible. And all those who are intending to have normal delivery after cesarean are most welcome, and they can be given adequate trial, and a lot of them, they become successful also. So here I rest my discussion, and I would want the audience to put up their questions if you have any. It was a very long session today because there was a lot to talk about. I'm done now. And there were some questions popping on the screen which have disappeared over time. So if you have any queries or questions, probably I covered all. So thank you very much for your patient listening, and see you next week, same time with some other topic. If you have any interest, you can write to me at jenchetna@gmail.com, or you can send a WhatsApp message on 9910907222, and we can cover a topic of your interest. Thank you. Thank you. Bye-bye.